Hi, fellow Pilates instructor. My name is Ariella Hayter, physical therapist and Pilates educator. And today I wanted to talk to you a little bit about SI joint pain. You're going to be seeing a lot of clients come to your private or group sessions that complain of SI pain. And so I'd like to give you just a few tips on how to work with these clients. Tip number one, typically these clients do need some alignment or lumbopelvic correction techniques. This is something I do teach in Clinical Instructor Academy. The link is below if you'd like more information about that. If you do not know how to align a pelvis as a Pilates instructor, this is the time for you to refer out to a professional like a chiropractor or physical therapist for your client to get assistance, making sure that their SI joint is aligned. Once they are aligned, then it's your job to stabilize this client. And if they're incredibly unstable and having symptoms in general with exercise, you can consider doing stability exercises using some support like an SI belt. The Sorolla is the gold standard. This is a slight knockoff from Amazon, and I'll just show you how this works. I'm going to take the belt and I'm actually going to place this low, just above my greater trochanter. And if you're not sure where that is, you can I'll turn to the side here and just rotate my legs slightly in and out, and you'll feel a bony prominence on your client. And then the belt needs to be just above that bony prominence. And from there, you'll take the first part of the belt overlap, and then you'll take both outer parts and tighten. You want this quite tight and pretty low, as you can see, right? I should be able to flex my hip so it's just above the hip crease. And what the client should feel is support. If this for some reason causes symptoms, then this isn't indicated for that client. And then I'll just demonstrate a very basic lumbopelvic stabilization exercise using my belt. So I'd have the client on hands and knees. And first, just rocking the pelvis a couple of times to find a nice neutral position. Once you find that nice neutral position here, lifting up one leg and seeing if you can lift the leg without allowing the pelvis to rotate. If they're able to do that, then having them extend through the leg, seeing if they cannot rotate the pelvis. And what you're going to see in a lot of people with sacroiliitis or SI instability is very much a challenge to keep the pelvis stable in this transverse rotational plane. And then you can take this into many variations that you all know, your bird dog variations. You can also take it into more helicopter variations where you're abducting the leg and arm, not allowing the pelvis to rotate. Working really slowly and methodically, and oftentimes having to manually and verbally cue quite a bit for clients that have extra mobility in their SI joint and may not have awareness of the positions that they're training in or functioning in. I'd love to know if you guys have any questions about the sacroiliac joint, specific exercises that you have questions about related to the SI joint. I'm here to help. Clinical Instructor Academy, the link is below.